In close cooperation to modern science, yes. I think we should not polarize. It's not either we work with this or that.
Just combining.
Not only the combination. I think the cooperation is most important. And in a good cooperation, I think we can have a very, very good treatment because we can work side by side. I'm a Western medical doctor, and also I studied Tibetan medicine during my medical education long ago. And for me it was a perfect change of my perspective. And today, for me it's not the decision either this or that. It's to find the best treatment possible.
But have you met opposition on your way? Some traditional doctors say just traditional medicine, no other alternative.
Of course. It's the situation now in many countries. I'm from Austria, and of course it's the situation very polarized and polarizing. And this is our main aim, cooperation. We don't need to adopt other positions, but we can have a side-by-side cooperation with different perspectives. That's our main approach. We don't want to integrate, like it's very popular now to say we have some kind of integrated medicine, which means we adopt what we like. But that's not the interest of this conference. We really want a cooperation side by side, and this year the program shows that we are really, because we have a side by side of different perspectives and speakers, and I think this would be good for modern medicine to have a side by side.
So what do you think about that kind of approach? Actually, nobody can cure you if your mind is not ready for that. Everything starts from each other mind. You need to clear your mind first. So, not a single doctor can make you feel okay. They like suppressing the symptoms, yes? I maybe feel I'm okay, but actually the root cause is still there.
That's it. I think, even in this case, it's you need to find an individual way. I'm a psychiatrist and psychotherapist as a Western doctor, and in psychiatry it's very popular to find solutions for many people. But in all kinds, people need an individual solution, and the first thing is to start some kind of relationship. And in Tibetan medicine, in the root text, it is said that any patient should be like your family member. So it's very important to have a good relation to each patient. And then the next thing is, if someone wants to go to the roots, and maybe it's very difficult to come to the roots because of
different layers.
Then we need to create a stable network of different therapies, so to slowly, stepwise come to the roots. That's the main interest.
Do you agree that all our problems actually start from childhood? Insecurity and depression and everything. Not to feel worthy. Grown up maybe that kind of beliefs that you are this or you are that.
Yeah. I think severe traumatization is something very special, and we have to take care if people have received severe traumatic experience during childhood. But I like one title of a very popular psychotherapeutic book in Western countries, and it's called It's Never Too Late to Have a Lucky Childhood. Because I think it's possible to work on a different perspective in any time.
Why Tibet medicine or just for depression? This is like modern sickness. Everybody seems to suffer under that.
The truth is, Tibetan medicine is very, very experienced in the treatment of modern symptoms like depression and burnout. And it was mentioned in all texts already. I think in cooperation with Western psychotherapists and doctors, they have really, really good offers in this case.
And I know Estonia. Okay, hi. Just one question. I know that also Onu Rodal is going to have a lecture here and she's practicing Estonian national herbs for curing. So, do you think that each of us should look around in our own garden and see what we can use?
I think it's a good idea. Anu Rotali did a great work here in Estonia and she's very experienced. And of course, the best thing is to use what we have in our own garden for the base and then to work in cooperation with more. But of course, there are a lot of things are possible with local herbs.
Is there anything you want to add yourself? I didn't ask about this conference. So why should people come? Why should they visit workshops?
I think there's a growing interest in natural and traditional medicines, but sometimes people don't know if they have to choose for one or the other, or we have different. And I think if people are ambivalent, they just should come and have some experiences, because it's good to find out that traditional medicines really are looking for close cooperation, and you don't have to decide between this or that direction. Just come and make some experiences. And this Congress offers a really good a welcome with traditional methods, and I think people should come and make their experience.
Okay.
Thank you.
So maybe we change seat now then.